the site is available for absorptions, and these site could be through various epithelia, mucosa of the gastrointestinal tract. So usually the GIT is the site for the oral route dosage form. Okay. What are the advantages? You all know that oral route, they are convenient. Okay. Patients prefer better than, oral route more than the injectable form. So it's a convenient to use. It's a portable. So it is easily available. Even OPD basis also you can use this route. There is no pain and easy to take. So conveniency is the first advantage. It is cheaper. Here, cheaper in the sense there are variations in the cost, but in cheaper in the sense of here no required sterilizations. When you use parenteral route, then you have to take care of most of the sterilization process, septic, aseptic precaution. Then it is a compact and cheap means multi-dose bottles are also available. So multi-dose are there in the for the oral route. Varieties of dosage form available. Let me tell you that there is a tablet available, capsules available, suspension. There are chances that patient may not like to take capsules because capsules are too big. So they may not be convenient to taking capsules. Then you can use the tablet. If it is available in a drug is available in a different dosage form, then it is varieties available and patients will have a wider choice. Again, you all know that advantage self-administered, so no required any assistance or the particular caretaker. And there are anyone would like to add any other advantages of apart from these four advantage, which is very common? Because I know book is there. Can anyone explain me apart from these conveniency, cheap, the cost effective, varieties are available, self-administration is possible. What could be the other advantages of oral route? I will ask number wise, then only I think it will be interesting. Roll number 20. Are you there? Roll number 20. So shall I mark absent? Roll number 20 is not there. Okay, 25. Is not there. Grishma is 25. Okay. Grishma, can you unmute yourself?
Yes, ma'am.
Would you like to say anything? Would you like to add any other advantages in this? Because I know only these four advantages. You can help me.
Ma'am, it is not more costly.
ये तो हो गया ना, वो तो मैंने बोला कि more costly in comparison of what? See, costly is a word कि वो मैं कौन सी ब्रांड में जा रही हूँ, ऐसा है. मैं जब when I want to buy clothes, it is my choice. Here you have to compare with the route. Fine.
Yes, ma'am.
Which are the other advantage? Would you like to add?
No, ma'am.
No? Fine. Comparatively safe. Somebody, Krishna has written comparatively safe, and Jaimil has written it takes less time to be consumed. I am not understanding this statement. Takes less time to be consumed. Jaimil, can you unmute yourself? Jo bhi, whatever explanations you want to give me.
Yes, ma'am. मतलब हम उसे जल्दी से ले सकते हो, उसके लिए ज्यादा टाइम भी नहीं लगता है. जैसे आईवी में बहुत टाइम लगता है कुछ भी अगर ड्रग्स और वो सब में.
अच्छा, फाइन. सो यू कैन से दैट जल्दी टाइम नहीं लगता है. सी, रिमेंबर हियर यू आर टॉकिंग अबाउट द टेक्निक. वी आर टॉकिंग अबाउट द रूट. सो दिस कॉन्सेप्ट शुड बी क्लियर, बिकॉज सी आईवी में और ओरल में जो है वो तो उसकी द कैरेक्टरिस्टिक्स ही है. ओरल में तो ऐसा लगेगा टाइम नहीं लगेगा और पैरेंटल में टेक्निक का टाइम है. We want the drug effect. Here the main purpose is the effect of the drug. So I think don't add that advantage here. But yes, you can say the conveniency and there is a self administration is possible, so no required assistant. Convenient for repeated use, somebody has written yes. See, repeated use I can understand. Here it comes the convenience. बार बार लेना है तो injections बार बार लेना, it is a non compliant for the patient. So that is also one of the advantage. You can add it here. Okay. So if you would like to add anything, you can write by your own in your theory paper or maybe in Viva you can tell us. So these are the advantages and the disadvantages here. Now here the question is slow onset. Slow onset means कौन सा slow onset? Effect, drug ka onset. I am talking about the drug onset because when you use oral route, then it has to pass through the pharmacokinetic process and there are some concept which is not applicable for the oral route. Okay, because जब oral route लेंगे तब हम will take tablet verbally, I mean orally, then it has to disintegrate. उसको अपने आप breakup होना पड़ेगा. Then it has to dissolve. उसको थोड़ा liquefied होना पड़ेगा. And then that drug is going to start its pharmacokinetic process. So it will take time. Whereas once when you applied the parenteral route, it will directly enter into the blood and it will start its effect. So in that sense, the term, I mean the statement I have written, that is a slow onset. Drug destroyed by digestive juice. Okay. And that's why there are certain drug properties which cannot be given orally. And the typical example is insulin. If you all know that insulin is given via subcutaneous route, can be given via intravenous route. And as I told you, the newer drug delivery, that is by infusion pump. See, the tablet or the oral route is not used for the insulin because it can be destroyed by the digestive juice. And that is the property of insulin itself. Okay, so that is a disadvantage. Then sometimes unpalatable and highly irritant drug cannot be given orally. So unpalatable drug has to be given via some other route, or maybe one has to modify that dosage form. So sugar coated banana padega usko. If that drug is unpalatable or in a sour in taste, then the technology will develop, it's a sugar coated. So unpalatable, highly irritant, so of course cannot be given orally. Then there are certain drugs which are not absorbed via GIT. Because of its property, it is available for the some other route. Say for example, neomycin. It is one of the antibiotic, or you can say it is one of the aminoglycoside antibiotic. And neomycin का तो ointment आता है, if you remember or if you have seen. Neomycin can be used topically. It has a local action. It cannot be absorbed through oral route. And that's why these considered to be the disadvantage. So these are the some of the disadvantage. Cannot be given to unconscious and uncooperative patient. We all know that emergency conditions, you cannot use this route. Cannot be given in patients with vomiting. Of course, patient can, it is not palatable for the patients. So cannot be given in patients with vomiting, and drugs with high first pass metabolism cannot be given. I will let you know afterwards, I think tomorrow, what is the meaning of first pass metabolism, or maybe today itself. What is the time here? Let me just, do we have another 20 minutes? Can I go? Okay. First pass effect means what? That it is used in the term of hepatic metabolism of any pharmacological agents. See, remember the drug, when you take drug, there are ADME, somebody has written, right? Pharmacokinetic process. So that drug has to metabolize to become inactive and then it will excrete out. उसको अपनी body से बाहर तो निकलना ही है. So it has to become inactive. Most of the drugs, they metabolize in the liver. Okay. Now, absorptions, where it absorbs in the gut. So what will happen? This first pass effect is that any pharmacological agents, when it is absorbed from the gut and when it delivered to the liver via the portal circulation, that is a normal process which takes place. Now, the greater the first pass effect, the lower the bioavailability of drug. Remember this term just now, very, very important term. Okay, bioavailability of the drug. What is I mean, the name it suggests, bioavailability. What is bioavailability? It is the rate and extent of the drugs which reaching into the systemic circulation. Our oral ka main purpose is to give systemic effect. So here important term is bioavailability. It is a rate and extent of the drug reaching to the systemic circulation. What is the relations of this first pass effect and bioavailability? When the drug is having a greater the first pass effect, the lower the bioavailability. Means uska rate and extent of reaching systemic concentrations, I mean the circulation will be less. So I told you, sometimes it happens that there are certain drugs having a greater first pass effect. तो क्या होगा, उसकी bioavailability where it has to reach the systemic circulations, uska rate will be less. Okay, so that is the first pass effect. There is another route which is relate with the sublingual route. Though the drug is given using oral route, but here it is called the sublingual route because while oral we are using directly, we have to swallow it. But in sublingual, you have to put the drug beneath the tongue. Okay, so these beneath put under the tongue. When you use that route, it is called sublingual route. It is available. It is called the formula. A dosage form is called sublingual tablet. Typical example of this sublingual tablet, you all have to remember throughout your life, that is nitroglycerin. These nitroglycerin, it is available in a sublingual tablet, and nitroglycerin is one of the drug which is used in the treatment of angina pectoris. Okay, so when there is an acute attack of angina pectoris, nitroglycerin can be used, and not in detail, I'm going to go into detail, but these drug has to be put into sublingually, so beneath the tongue, and that can relieve the pain of angina. So nitroglycerin is available in a sublingual tablet. What is the advantage of these tablet here? You all know that compared to using oral route, if you put the drug in sublingually, there will be a rapid absorption. The second advantage here I have written, rapid absorption, because there is a good supply, because of the blood supply is very good and absorption is very fast. Okay, there, sublingually. So rapid absorption is one of the advantage. And here, what I told you, first pass effect, when you use sublingual route, then there is a avoidance of hepatic first pass metabolism. So liver will be bypass. Okay, and what is the correlation here? Once the liver will be bypassed, bioavailability will be higher. So uska rate and extent of reaching circulation, systemic circulation is very fast. So the inverse proportion of first pass metabolism and bioavailability. When there is a no first pass metabolism, bioavailability is very high. And that is applied in sublingual route. You require to relief of pain in angina fast. And that's why these route can be used and especially that is for nitroglycerin. When you use this sublingual route, then pH in mouth is neutral. So the drug stability will be more. Drug will remain stable and there will not be other changes of the drug physical properties. So that is the advantage. Only the disadvantage is there is a little inconvenience for the patient for holding the tablet in the mouth. And the small dose can be accommodated easily. If you want to give these nitroglycerin for relief of pain, there is a standard dose that you can repeat these dose only 5 to 15 minutes with the interval of this 5 to 5 minutes. Only 3 times one can take, not large dose. Okay, then the next process is one has to start the other medicine. So sublingual use, only small dose can be applied by this sublingual route. The other route I will cover here today, that is a rectal route. Here the two dosage form is used, that is a suppository and enema. Same like in rectal route, it will bypass the liver. Okay, and these rectal route will be useful in unconscious patients or maybe in a younger children if patient is having nausea and vomiting. I will give you one of the assignment and tomorrow you will discuss with me. You write down your assignment. What is the meaning of aerosol? As I told you, inhalational form, the substance can be given in aerosol. So the one assignment is, what is the meaning of aerosol? You all have to find out. And second is, which are the drugs can be used via rectal route? At least you write down the name of the drug so you can remember. You find out and we'll discuss it whenever the next class is there. Okay. What is the disadvantage of these rectal route? That it has absorption is not complete. Okay. Sometimes there is erratic absorption, so it is incomplete, and that's why maybe sometimes the effectiveness of the drugs may not be proper. And rectal route not compliant for all the patients, so it is not well accepted. That is the disadvantage of rectal route. Okay. So I think now I will stop here because still we have 10 minutes, but 15 minutes, but I will stop here. Somebody has to say the key points of today's class and then I will stop the class here. Next time I am going to cover the parenteral routes in detail. That will be on Monday, and on Tuesday the details of topical route. Okay. So whatever I have discussed today, few key points